Orthodontics. What is orthodontics? Well, I'm sure many of you have either have experienced or are experiencing going through ortho treatment. And if you haven't, well, you're not missing much. Orthodontics is a specialty in dentistry that involves the movement of teeth, and there's going to be different types of treatment that's going to warrant orthodontics. Yes, ortho does help to straighten the teeth that may be rotated or crowded. They're misaligned in some way. So it tries to get them back to a more functioning manner where they're straight. It does correct, like I said, crowded or even uneven spaced teeth. So maybe those individuals that have diastemas in between their teeth, which are the spaces in between their teeth, it's a way to kind of push everything together to close up those spaces. Orthodontics does correct bite problems. So if the patient is experiencing some malocclusion, then it can definitely help to correct some of that and allow them to eat properly and maybe relieve some of the TMJ issues that they might be experiencing. And it does help to align the upper and lower jaws. Again, if done correctly uh, and with a trained specialist, then orthodontics can help to treat a lot of different issues and situations. You may have seen either advertised on TV or Facebook or social media with the Smile Direct, where they send you some stuff, you take impressions of your mouth, you send them back, and then they send you a series of trays, and you're basically the orthodontist. You're moving your teeth. Well, that's not a healthy or ideal way to be doing ortho. It does need to be monitored, and it does need to be done by somebody who is trained to be moving teeth, because what happens is if teeth are moved either too quickly or not the correct way, then it can actually lead to some periodontal issues. It can lead to just some overall issues with the occlusion altogether. That is going to be more extensive and harder to treat to try to get the patient back to where they need to be. So things like that, if it's too good to be true, then oftentimes it is. So if you have patients or even friends or family members that have mentioned going through something like that because it's cheaper, we always want to caution them and advise them that, unless you're being seen by a trained professional, it's, not a quick and easy fix. It takes time to be done in order for it to be done right and correctly, so that they don't run into the issues that could occur as a result of doing it on your own. So just my little disclaimer that I wanted to throw out there, because I'm sure many of you have seen that, and it seems like a very convenient way to, do orthodontics because you're doing it yourself. You don't have to worry about going in for appointments, but there are definitely a lot of concerns and issues that can arise from doing that. So just want to throw that out there. So what is orthodontics? Well, again, ortho involves the use of brackets, which are cemented or bonded onto the facial portion of your teeth, and the uses the arch wire, various types of arch wire, to move the teeth. It's not the brackets themselves that actually move the teeth, but the wire, the arch wire that is placed into it, that is the one that's going to be moving the teeth. And there's different sizes and shapes to the arch wire, and each arch wire is going to be doing something specific. So when it does come to the arch wire, like I mentioned, there's different types. It can be made out of niti or nickel titanium, beta titanium, stainless steel, or it could be something called an OptiFlex. I don't believe I have one here to show you, but that's basically kind of like a clear material. So it doesn't look very obvious that the person has braces. Very similar to the brackets that are available. The patient can get the metal, traditional metal brackets. I don't know if you can see that there. Or they can get these ceramic brackets, which are tooth colored. So again, it's meant to be a little bit more invisible. However, in order to keep the arch wire in place, you do need to put some sort of an elastomeric or ligature around it, whether it's metal or the rubber. So either way, whether you have the metal or not, there's still going to be something surrounding those brackets that attach the arch wire and keep it in place so that it doesn't fall out of the mouth. So with the arch wire, what they typically start out with is something that's really flexible like this. You can see that, it doesn't really have any give to it. I can, twist it. I can move it around very, very easily. Very, very flexible and pliable. So they usually start the patient off with something like this. Then as the treatment progresses, then they start moving to something a little bit more rigid. And that's again to provide the shape for the teeth and the arches. So this is what's going to move your teeth. Believe it or not, the wire is what moves the teeth, not the brackets. The brackets just basically hold the arch wire in place. Other components to braces, this patient doesn't have it on there, but typically they will put bands. And the bands will usually go on the 6s. So if you remember with orthodontics, we are no longer using the universal numbering system with 1 through 16, 17 through 32. We're now using Palmer notation with the 1 through 7, where the 1s represent centrals, 2s laterals, 3s canines, 4 is the first premolar, 5 is the second premolar, 6s are going to be your first molar, and your 7s are going to be your second molar. And if the patient had a wisdom tooth, then that would be their 8s. So again, 1 through 7, if they're missing their wisdom tooth, is how the Palmer notation is going to be utilized. So same thing, it's the same for upper and lower. It's just that the way we would say it would be upper right 6s, upper left 6s, lower left 6s, whatever it is that we're doing. And you will notice too that oftentimes the brackets, let me get what that looks like. The brackets may be in something like this, or it could look very similar to a little card, and on that card it might list 1, 2, 3, 4, 5, 6, and that just lets you know that the 1 corresponds to go onto the central, and they're going to have for both upper and lower, right and left. So it would be kind of shown on the card is that way, so you know that that bracket goes to that tooth. So bands are going to be, again, something that are going to be placed on there, which the arch wire would typically fit into the band, and it also is held in place, holds the arch wire in place, and just provides a little bit more stability to the braces and the arch wire itself. Sometimes bands are needed, sometimes they are not. Oftentimes, either the brackets themselves or the bands, I don't know if you can see that or not, will have some sort of a hook on them, and that's to allow for the elastics or rubber bands, and let me get those here, to be placed on the teeth. And for those of you that have either are in braces now or have recently had braces, sometimes the elastics or the rubber bands will come in colors, or sometimes they will just be the plain kind of beige color of rubber band. But with these wires here, or those little attachments, what we can do is sometimes place the rubber bands in a manner where they might be opposing, or they could be from the molar all the way to a premolar. And what that does is it helps to either close the bite up or open the bite up a little bit more, depending on how you're placing those rubber bands. But those rubber bands have to do with the relationship of the occlusion. So oftentimes when the teeth are being moved, they're not only moving the teeth, but they're making sure that your bite is going to be appropriate. Remember, we're wanting a class 1 occlusion, where that upper molar, the mesial of that upper molar cusp fits very nicely into the groove of the mandibular uh, first molar, into that groove that's kind of there on the buccal, to make it a normal or class 1 bite. So all of these things are a part of what involves braces. This is kind of the initial or the treatment phase of it, where periodically they'll change out the wires, depending on what it is that the orthodontist is trying to achieve. And then they place some sort of ligature tie, whether it's metal or elastomeric, around the bracket to be able to hold the arch wire in place. And remember, the arch wire is the one that does the moving of the teeth. The brackets and the bands are typically there to hold the arch wire in place.